Welcome back to the show. Joining us now is Chantell Harmon Reed, Director of Public Health, Tacoma Pierce County Health Department. Chantell, welcome to the show.
Oh, thank you so much for having me.
So good to have you here.
Yes.
So I have a few questions for you, for our viewers. So can you tell us, as Director of Public Health at Tacoma Pierce County Health Department, how long have you been in this position?
It's been just about 10 months now. Yeah. I've been here getting acclimated and learning the area and learning the role here in the area. So, yeah.
Okay, well, welcome.
Thank you. Thank you.
And one of your first priorities was to update the health department's strategic plan. How is that work going?
It's been an interesting journey. I had the opportunity to not only learn the health department, but also I had an opportunity to go about and learn Tacoma, learn Pierce County. So I have been ingratiating myself into the culture. So I have been navigating and learning what makes the city run and how the residents of this area, what makes them great.
Okay,
Yes.
and 10 months in, I'm sure there's a lot more to learn. You have a lot on your plate, so
Yeah.
baby steps, one day at a time.
Yeah, one day at a time. One day at a time. It's been a learning process, and the people have been so gracious and so kind,
Good.
welcoming me into the community to learn so much more about everything that Tacoma has to offer.
Well, that's good to hear. And with you being from New Orleans, I'm sure you've experienced that Southern hospitality.
It has been amazing. I've been in the Pacific Northwest about 2 years now.
Okay.
But I like to say that Tacoma has been the most welcoming since I've been in the Pacific Northwest. So yeah, It's been a great experience, I have to admit.
That is
Yeah.
definitely good to hear.
Yes.
So as far as the strategic plan goes, how do you use this strategic plan?
So the strategic plan is a critical part in us really kind of navigating like our guidebook, right? It is the framework in making a determination on how we're going to plan our activities. It really speaks to our goals. It also speaks to what the community's goals and frameworks are, and really tells us like how we need to plan our activities. We want to make certain that how we do our work lends to the objectives of not just what we want to do as a department, but what the community wants to see. So it really gives us really like the tools, right, to make sure that we are not operating under our own guises. We want to make sure that you hold us accountable. So it is like you can go back and refer to, okay, what did the health department say that they want to do? And it allows us to be able to say, here's what we put forth in our plan, and allows us to be able to say like a measurable tool to say that whether we achieve those goals or not.
Right, and the input of the community is important, and in order to provide them with the needs, we need to know what those needs are.
Exactly.
Yes.
Exactly. We don't want to just operate on our own manifest. We want to make sure that the community speaks through and to us in us setting those plans.
Absolutely. And I don't think our viewers realize the amount of work that your department does. So can you share with the viewers the different ways that that your department assists the community, the different programs?
Absolutely. So any public health agency really is about like how we live, work, sleep, and play. So some of the programs that we do really is like, I think about our Strengthening Families Division. We look at Black infant health. We look at how we support vaping activities. How do we support prevention, really, right? So prevention, whether that's smoking, drug use disorder. How do we look at septic tanks, environmental health? How do we look at vital records, right? So you come to the health department to get your birth certificates and death certificates and that information. We also support businesses and how they get their inspections and how they go about the regulatory environment in being able to operate those businesses. Clean water, making sure that, how you are able to access our waterways, making sure that all those things are clean and safe. There's so many things that we do that happens in the background that people don't necessarily realize that the health department is involved in, but we play a very critical role in the everyday lives of people every day.
And even for me, the information that you just shared, I'm just like, wow, I didn't realize that there's so many different programs that the health department provides. So that's great information
Absolutely.
to share. Yes.
Yeah, absolutely.
And so I also understand you're developing a new program right here in Tacoma called Street Medicine.
Yes.
Can you tell our viewers a little bit about that?
Yeah, so we are absolutely excited to roll out this program. It is one that I have been very familiar with in the course of my healthcare years. It was a need that we know meets us in those people that are unhoused and are homeless in our community. Oftentimes they are, in a state of despair, just, where they are, just living in community. And it is an opportunity for us to meet them where they are. So what we are going to do is we mobilize units that goes directly to them. Transportation is an issue, making sure that they sustain their belongings. Sometimes they don't want to be able to go to facilities or go to clinics because they don't want to leave their belongings. This allows us to be able to go directly to them and provide clinical services. So whether that's wound care, sometimes that may be a meal, sometimes that may be some direct services like diabetic supplies, it may be incontinence supplies, it may be for women, it may be some sanitary supplies. It could be the gamut of different things that they need in order to make sure that they are safe from a health perspective. We're going to be going out to them definitely right now 4 days a week with 2 teams that are going to divide and go through to make sure that they don't have to worry about how they're going to get some of those daily needs met. It is a startup process, but we hope to incorporate this into the services that we provide on a regular basis as a health department.
And to your point about meeting people where they are, we do have a very large unhoused population. So the fact that a lot of those individuals can't go to the care, I think it's a beautiful project that you're able to take that care to them.
Absolutely.
So that is wonderful.
Yeah, we want to make sure that no need goes unmet, and we're trying to make sure that we meet those needs as best as possible. I know, we've all been in a state of, wherever that is. Sometimes it's not just financial. It is just like you need something right then and there. We want to be able to support people as best we can. So it is a great opportunity for us to fill that need.
Yes. And you mentioned that this is a fairly new project, so we're looking forward to hearing more about that, getting those updates.
Absolutely, absolutely. So right now, reach out to the health department. We'll be in your communities. Look for those. There's going to be an RV. There's also going to be a van that goes around into those communities. Support us. The staff will be out. If there's anything that you can do to support those, we have volunteers that are going to be supporting. There's community clinics that are going to be supporting that work. But whatever we can do, please, feel free to reach out and work with the health department and lend in those resources.
Okay. Now, also, being that it's winter, we are also in the middle of respiratory illness season.
Yes.
Can you talk a little bit to our viewers about what they should know?
Well, it is coming off of, like COVID-19, right?
Yes.
That was where I think we all have been in a state of like heightened awareness about the transferability of disease, right? Right now, we are in a state of just susceptibility for especially our young babies, especially for our elderly population, and just those vulnerable amongst us, right, who are just have compromised immune systems. It is critically important for us to make sure that we're washing our hands. It is exceptionally important for us to make sure that if you're sick, stay home.
Yes.
I know if some of you had the opportunity to see me at one of our board meetings in January, I had on a mask. I knew that I had a cold, I had respiratory illness. I did not want to transfer that on to individuals, so I made sure that I covered up, I was washing my hands. I made sure that I did not pass that on. Those are some of the best things that you can do. You can come to the health department. We have masks that we'll assist people with. We have COVID tests that we'll assist you with. But also go into your local providers. Make sure that you get tested. Make sure that you get your immunizations and that they are all up to date, not only just for your children, but also for yourselves, just so that we're not passing on these viral infections to others. We want to make sure that we're as safe as possible. And we don't want the transference of disease.
Absolutely.
Yes.
Now, so in regards to vaccines, because a lot has changed since the pandemic, what is the best way for people to know how and where to get vaccinated?
So you can always go to the health department's website. You can go to tpchd.org.
Okay.
Also, you can go to the CDC website, but also at your local primary care physician's office. I suggest, right, absolutely please develop a relationship with your local primary care physician. If you don't, there's community health clinics that are around our community that you can connect with. But those are absolutely opportunities to make sure that you are aware, specific to your individual needs, so that you know what is the best treatment course for you. It is imperative for us to make sure that we stay on top of these things, just so that we are not navigating through in a state of, of sickness, right? We want to make sure that we're as healthy as we can be.
Right, and particularly with a lot of employees returning back to the office.
Absolutely.
Children are in school, and we know our little people, our littles, they bring everything back home.
They do. As a child, as a parent with a child in school myself, I know how it happens. They pass on these diseases, and we're trying to stay as well as we can.
Yes.
I know we did it just in my house alone, and we're saying like, okay, we tend, right? We cocoon. My son is laying next to me. I'm laying next to him, and we pass these things on.
Right.
So we want to make sure that we're not passing this outside of our homes, right? But also it is helpful, right, that we both had our vaccinations, and in both of us having our vaccinations, we're not as sick as we could have been. So
exactly.
It's critically important for us to make sure that we take care of those things.
Definitely.
Yes.
And, just to wrap up, Chantell, is there anything else that you would like for our viewers to know, even in regards to volunteer opportunities?
So I want to be able to say, like, to everyone out there that the health department is a resource, and we are a beacon. I want to say that we are right over here on D Street. Come over. I am there most often days, as much as I possibly can. Stop by. There are opportunities to support the work and the efforts, to be able to make sure that we're doing everything that we possibly can. I try to make sure that I'm out in community as much as possible. If you see me, stop by, say hello. I'm a listening ear. There's always an opportunity for me to learn as I, become a part of my new community. I'm excited to be here. I'm excited to learn. So whatever opportunity we can for you to become a part of our culture and making sure that the health department grows and that we are learning and making sure that we listen to your needs, please seize that opportunity. And if you see us, make sure that you lend your ear to us, and make sure that you lend your voice to us, to make sure that the health department is accountable to you as community. So thank you for having us. We are very, very excited to do this work. And I'm so happy to be here to be able to make sure that I contribute in meaningful ways to this community. I hope to be here for a very, very long time. And I'm really looking forward to making sure that it is a continued place to be.
Absolutely. And we are so glad to have you.
Yes,
So
yes.
thank you for all the work that you're doing, that your department is doing, and we look forward to hearing more.
Absolutely. Thank you so much.
You are very welcome. Thank you again, Chantell.
Thank you.
Don't go away. We'll be right back after this short break.